Hey everybody, Dr. Jason Barker with Rocky Mountain Natural Medicine, and I wanted to make a video today about a question that I get all the time in the clinic, and that is, hey, I'm hypothyroid, I'm on a medication called Synthroid, my labs look decent, but why do I still feel hypothyroid? Why can't I lose weight? Why am I still gaining weight? Why is my hair dry, coarse, brittle, breaking, falling out? Why is my skin dry? Why am I swollen in my legs? Why am I cold? Why am I constipated? The list of symptoms goes on and on and on. Well, the problem with this is that Synthroid is only comprised of one of the main thyroid hormones that your gland makes. So you make T4, which is thyroxine, and you make some T3, which is thyrionine. 80% of what your thyroid makes is T4, and then the other 20% is the T3. Now that T3 is also about 4 times as strong as the T4. So what does all that mean? It means that all of the money is on the T3. T3 is what gets the magic done in your body. So if you're on Synthroid, which remember I said is primarily made of T4, what's happening is you are not converting that T4 into T3 at a cellular level. So why does that happen? Well, we don't know why that happens in everyone, and there's not a test to actually look at this. But we can work with you to figure out how we can make that conversion process more efficient so that your symptoms go away. Okay, this stuff is not all in your head. It's something that we see very commonly, people who are poor converters of T4 into T3. And the reason you have normal labs is because that T4 from the drug is obviously circulating around in your bloodstream. It goes up into your brain, into your hypothalamus, which detects what all of your glands are doing and all your hormone levels are. And it says, hey, well, it looks like there's enough T4 in here. I'm not going to do anything with the thyroid. I'm going to leave it alone. Hypothalamus sends a message down to the pituitary gland, which is in the middle of your head. Pituitary gland is what releases the TSH, thyroid stimulating hormone, and that's the one that gets primarily measured in lab tests. So that can often look normal, but you're still having symptoms. And again, it's because you're not converting that T4 into T3. So at our clinic, we're going to work with you, get a lot more comprehensive blood work done, looking at a lot of different aspects in thyroid level or thyroid hormone levels, and figure out why you're not converting. Remember, there's not a specific test for this, but based on your symptoms and some of these other lab tests, we can put the pieces of the puzzle together. And then of course, we use a lot of different natural medicines that can help with that conversion process. And they also help making the actual thyroid gland more efficient. So one thing that we don't want to see happen is that you're still having all of these symptoms. You go back into the doctor's office and you say, I don't feel so hot. And they say, okay, more Synthroid. Okay, more Synthroid. It happens year after year after year. The answer isn't to increase your dose of thyroid hormone. The answer is to figure out why your body isn't converting it and how we can help your body actually utilize those hormones that you're making so that all of those symptoms go away. Okay, it's no fun running around with hypothyroid symptoms. So if this sounds like you or somebody you know, please have them give us a call or come in the clinic. One of our doctors will work with you to help get your thyroid fixed up, make things more efficient so that you don't have these symptoms so you can feel better. Okay, if that sounds good, please give us a call. Otherwise, thank you for watching, and I'll see you again soon.